Okay.
Hello, everyone. Happy Friday. I hope you guys are all enjoying this beautiful weather. And if you are outside the Seattle area, that you're going to have a good weather wherever you are. Welcome to our conversation. I'm glad that you were able to join us. My name is Jesús Bervis. I'm the eligibility manager at Neighborcare. And with me is Dr. Malloy from Community Health Plan of Washington. I'm going to tell you a little bit about eligibility. Eligibility is what I call the connecting to access component at Neighborcare. We help folks to learn and enroll in the programs that are available out there for them if they qualify. I will compare it with the ignition key of a car. The car may have a wonderful features like our providers and other staff members, and eligibility is the one that kind of put us in motion, especially those that are uninsured, underinsured, the hard to reach populations like the homeless, immigrants that probably English is not their first language. So that's kind of what we do at eligibility, and and the analogy is for you to visualize the importance of our role as eligibility staff at Neighborcare. And I will let Dr. Malloy introduce herself.
Great, thank you, Jesus. Nice to be with you and everyone today. I'm Dr. Demetria Malloy. I'm the Chief Medical Officer and Chief Health Officer for Community Health Plan of Washington. And in that role, I work across the organization, but am more responsible for a lot of our clinical teams that deal with case management and pharmacy and our medical directors, and a lot of the ways that we look at services and make sure that we coordinate it for all of the members that entrust us with their care.
Yeah, thank you, Dr. Malloy. I think it's important for us as a provider to have partners like Community Health Plan of Washington. The one thing that we have in common is that we are nonprofit organizations. We don't keep all the money that comes to us in our pockets. We pass that along to the community through the services that we provide. And we work together in many capacities, and one of those capacities that I can think of is with the recent end of the public emergency. We reach out to those that were affected, that were disenrolled because they no longer qualify or they didn't respond to the materials and the communication sent to them. And we partner generating reports and reaching out to those folks that were affected or that are going to be affected. I would like to share a story so you can visualize a little bit how this work and what we do impact people's life. We had a patient that has been a patient for us of us for years. She came to one. She was a patient of one of our clinics in the North End, and she saw one of my team members. We tried to help her. She was a self-employed, but didn't have a structured work. So when we asked for proof of income, she said, well, I work for many clients. I get paid cash sometimes, so I don't have a structure to like pay stubs or things to demonstrate my income. So my staff member told her that she could just use a profit and loss statement. And she said, I don't have that. So my staff members directed her to the website sample and printed for her. And to make the story short, years later, she came back, but she went to a South End clinic and went and saw one of my staff members, and she was recertified for the program that she qualified for. And she said something like, "Oh, you guys are awesome." And then she shared the story. Years ago, I came when I was starting my business, and Abby shared with me after helping me with enrollment. She shared with me this tool. I've been using this tool for years, and now I'm successfully retired, and I'm now sharing that tool with other people. So she came to us for a specific service and need. We were able to help her with something else, and she still used that tool. So that is to give you an example of how we go above and beyond to help people sometimes. And those people sometimes they are lost in the system. They don't know what to do. And this give you guys hopefully a picture of how we help people in many different capacities. So
You know, I really love that story. I think it's like gives a real example of how, you know, individual care happens, right? When someone comes in, they sort of ask a general question, how your team digs deeper and looks and says, you know, how can we really help you with what you need to work in this system, right? The system can be pretty confusing overall. And like you guys have your role in doing some of those things. And hopefully, you know, I mean, our goal at Community Health Plan of Washington is to make sure that we partner with really great clinics and homes of care, like Neighborcare, just to make sure that, you know, when they're answering your questions up front at the clinic, we also, you know, try to make ourselves available and make sure we're good partners with them. So they have the right information, but also to make sure that when you're needing a service and your provider, you know, requests it, what comes into the health plan, that's what we get that request, is to make sure that we coordinate it, that we're making sure that we're working with your providers to really hone in on whatever the question is, what is the particular thing that's going to benefit you the most, and have you have a tool moving forward, right, in your overall care. I think what you really described too was a lot of the piece on like how each of us really even play into addressing health equity and really just giving people, and I always say like health equity is really giving people the tools that they need to optimize their health. And those are different tools for everyone. But what hopefully, you know, our goal is, and I know Neighborcare's goal is to, when people encounter us, know that that's what we're searching for, that partnership, that tool for you that's going to help you have the best health possible. So we ask questions, we sort of dig deep there, but the goal is really to get you what you need in the timeliest way, in the best way for your overall health, right? And sometimes, again, that's a process that repeats itself, right? Because you need a different thing now than you did last year, than you did the year before, and so does your family and everyone around you and all of your loved ones. But it's our goal to partner with you and keep answering that question and getting you what you need over time.
yes, and that story is one of many. Each person that come to us for services is a story, and it's a successful story. Many people come to see our dentist and they can smile now because they got their teeth fixed, or they can just walk with confidence in the street because they saw one of their mental health professionals, or whatever service they got now, they advance in life for success. And that is what make me come to work. And I invite you to join our efforts. If you are on the chat, there should be a link there that you can click and donate. If you are online, you can visit our website, click donate on that orange button on the right corner, upper right corner, and just give a contribution, and you will be part of the changing lives work that we do here. With that, it's important to realize that insurance is a pain. You know, I had to renew my insurance every year, and sometimes I get lost, and I work with this, you know, And there are so many options, different things, and it's hard. And imagine for those that English is not their first language, or they are coming from a country that they have a different healthcare setting, and they don't need to file forms or fill out forms or do any of the things that we do here. Some people, they don't know how to read or write. Many are, homeless, so they don't have access to computers and things. So it's really complicated. And what we do here is we try to simplify that pain, make it easy for people. We do a one-on-one assistance, personal, in person or remote, whatever the person's choice is. We hire people from the community. So within my team, I have 16 people, and within my team, we speak more than 20 languages, and we can help people in their own languages, understanding their own culture. And we also have an interpreter line that we can reach all the other languages that we cannot speak here. So,
and that's a lot of the partnership again with equity and making sure people get what they need. We love so much that you're like at the personal point of care with people, like right when they, need something in the clinic to help them with those questions. And I do know that insurance can be a pain. It can be confusing for people. I've spent years in it, and it's still something I'm keep learning it. But I just want people to know, Neighborcare Health has a really important role in sort of that upfront care as well. And then the insurance system is a lot of the system behind the scenes. So, as the state is dedicated to taking care of members in the state, and they have Medicaid, they dole that responsibility out to a number of health plans, and there are strict guidelines, there's strict rules, there's everything. But our role is really to make sure that we take in all the requests for care that need to be honored, that we process those, that we coordinate those with your providers, making sure we help direct you so that when you show up at Neighborcare Health, you know where you're going, and they can help you when you come in the door there, and coordinate with us behind the scenes. But it's important that we take in all of those requests and make sure that things have some medical value and necessity for you, and then also make sure that we coordinate where you're actually getting that care, and that then we pay the bill. So that's a lot of our role, right? So everything that goes all the way to that endpoint is important for us to keep contact with. And we really rely on having great clinic partners and providers that really care and take that same effort, right? So when you're walking into clinic, you feel that same care, that same partnership, that same openness for you that our partners like Neighborcare Health really offer.
Yes, and as a federal qualified community health center, we had the privilege of serving anyone. We see people that have insurance, people that are self-paid, that can afford to pay out of pocket, people that don't have anything, and we don't deny services for somebody that cannot pay. We see them. And then we try to help them to connect with a program that they may qualify for. And if they don't qualify for anything, we absorb the cost. So it's a very privileged situation of us that serve everybody or anybody that come to us. We also are involved in shifts in policy. I've been working for Neighborcare for many years, and partnering with state entities, community organizations, and other organizations that do similar work, maybe a different capacity, they serve the same population. We have been able to give ideas to legislators and work with them, let them see what the needs are, and things are being moving forward. We have achieved great things. I don't know if you're aware, Washington State is one of the lead states in the nation in terms of access. Policy-wise, we have implemented many programs that are not only for people that federally qualify for services, but we extend that access to residents of Washington State. It doesn't matter their immigration status, and they still have some requirements, and income is probably one of the most important one, because we are trying to help those to get in the door, those that never had the chance to see a doctor because they cannot afford to pay for one. So we are trying as a state to open that door of access for all.
Mhm. And it's another part of partnership that I know we really enjoy Community Health Plan of Washington with Neighborcare Health as well, in advocating for making sure that the people who do write the laws and the legislators and have the policy and grant the funds know what the need really is and are actually making sure that they're putting forward the right funds and they are covering the right things. So we advocate for new programs, new kinds of care all the time. We certainly rely on our clinic partners to let us know what it is you need. So when you come through the doors and you're vocal and you advocate and you are honest with your providers, we then partner with them as well to make sure that we're saying some of the same messages and taking that to the state too. So it's really important to make sure that we always empower the clinics and empower our partners so that we can then also take that message up for you.
Yeah, and when we look into the future, there are things that make us happier and excited and make us want to do more. And one of those things is working to further health equity. Our doors are open to anyone. We don't see race, we don't see social status or economic status or religious status. We don't see that if somebody has a mansion or is homeless, anybody is welcome to us. And that is a dream that people in maybe other states, other countries can replicate our efforts to eliminate those barriers and obstacles that people usually face historically. They are people that have been marginalized, and our doors are open for them as well as anybody.
Okay, I think we've gotten a couple of questions in the chat. One of them being, for someone looking to be a navigator, what resources would you suggest?
Yes, our state has, we have our own marketplace, and they are responsible for certifying people to become navigators. So you can go to the Washington Health Benefit Exchange website, and or you can come to us. We can connect you with the Washington Health Benefit Exchange. You have to belong to an organization that does this work. I think that is the control that they have to make it a little more organized. You have to be part of an organization that they will sponsor.
Mhm. And navigators are a really broad term. There's a lot of ways that people can help others work through the system. There's some directly at the clinic level. At Community Health Plan of Washington, we have whole teams around that we'll call them names like community health worker or care manager. And we also have our customer service team. So there's a lot of ways to sort of get in there to make sure that you can apply for roles or jobs and get training and help other people, depending on which way you feel is best for you and which way your skills are and where you are looking to maybe touch the community directly, make sure you take people's calls and direct them. So there's a lot of ways to sort of get in there. And I think that you can find some of those opportunities on the website as well. And then also to call in and ask. There are a lot of different positions because we're very committed to making sure that we do have those kinds of functions and those kinds of people who want to help working for us.
Yeah, and with Dr. Malloy's comment, I realized my answer is being given with the lens of healthcare navigators for the exchange. There are many navigators out there, titles that are not necessarily related to the health benefit exchange. The my response was based on the assumption that your questions was about the navigators for the health benefit exchange. But again, you can contact us and we will be glad to help you to clarify if that's not the case.
Lots of ways to get involved and to help. Always look for the way that you can. Any, small contribution and help it's really important.
Yes, one of the advances in legislation is that recently it was passed a law that allows the states to expand Medicaid. And we decided to be one of those states. We expanded Medicaid, and now it's going to be based on state residency and no federal requirements, meaning anybody can apply for those benefits if they qualify based on their household composition and income. Before that, people that were not eligible due to immigration status, they were out of the picture. They couldn't access the public sponsor insurance programs through the health benefit exchange. But now there are options. There is a Medicaid expansion or Apple Health expansion in our state, and also Cascade Care and Cascade Savings, which are public options, also allowing people that they can apply for those services regardless of the immigration status.
And if you're talking about Apple Health expansion, a lot of the same benefits that happen under Apple Health, which is, Washington State's what we call our Medicaid, is being offered to people as well who, regardless of their immigration status, like Jesus was mentioning, and to make sure that there are also other things being offered that are maybe more particular needs, like making sure that there's language translators and there's ways for people to feel comfortable when they come in to clinics and to get care. And that we're making sure that we ask the right questions to get to the care that you need and faster and in your language. So making sure that those things are tied together. And so, organizations like mine, Community Health Plan of Washington, partner with organizations like Neighborcare Health to make sure that we're doing those things in a dignified way, in ways that are really helpful to people, and very happy to expand it as much as possible.
Yes, and we I'm sure as we were talking, health insurance is complicated, right? So I want to make sure that you guys understand Medicaid is a federal program. It's a public sponsor insurance that is kind of directed by the federal government. Each state administer those. And then when we talk about Medicaid in our state decided to give a name to the program. It's called Apple Health. And Apple Health is kind of an umbrella that has Medicaid and then has a program that look like Medicaid, probably with the same benefits, but expand the access to people that don't qualify federal requirements. So our goal is 100% access and 0% disparities. And those are things that prevented people from accessing before is now being open, and we're gonna see more access, and we're getting closer to reaching that goal of 0% access and 100% 0% disparities.
Fortunate that we live in Washington and have taken advantage of that as a state. We got a really good question in the chat that I would love to answer. The question is, what makes CHPW, Community Health Plan of Washington, different from other insurance partners? And as Jesus was explaining some of the system, when the state is looking to make sure that the Medicaid benefits get to everyone who can be eligible, and now we're expanding who's eligible, right? They push that effort and those tasks through health plans to make sure that we follow all of the rules and take in all of the requests and coordinate all of the care versus, just someone at the state doing it, right? So they give that particular task to different health plans. There are 5 in the state of Washington that can do that you can sign up for under Medicaid and are sanctioned by the state to be able to do that. Community Health Plan of Washington is one of them, and we are the only one that is not for profit. So that's one way that we stand out in particular. And in that way, you know, we just make sure that anything that we do take in, we are really big on reinvesting that back in the community, and particularly as well through our community health centers, like Neighborcare Health, to make sure that there are expansions of programs, continuing things that are getting better, that we can cover as many people as possible. So we work very closely with the community health clinics who also have the same goal and are not for profit to make sure that that gets expanded out and everyone gets it covered as much as possible. So in that way, that's just, we're super mission driven, and that will lead with everything that we do. And it often guides our partnerships that we do have and why we think community health clinics are so important. So the type of work that Neighborcare Health does and a lot of other community clinics, we just put at the top of the list of what we reinvest in and partner with.
Yeah, and we are in the process of changing lives, but because we are nonprofit organizations, our pockets are not as deep as many for-profit organizations out there. So we cannot do this alone. We need your help. It takes a village, right? Like the saying. So we invite you to join us in our efforts. And again, one way that you can do that is with your contributions. If you're in the chat, just click in that link. If you are online, go to our website and make your contribution. And if you are out there that retire or unemployed and you are looking for a place to work, you can also check us out and see if there is anything out there that you would like to do. We will be glad to have you on board.
We need everyone, right, in this work. It's very important. We appreciate it.
Again, thank you for joining us. If you have more questions, keep sending those to us. Then you can click on contact us and send us your questions. And in the meantime, I hope that you guys enjoy the sun out there on the rest of your day. And thank you again for joining us.
Thank you.